back in the 70s, they would give us a bunch of injections of penicillin. And so about the sixth or seventh one, I had an anaphylactic reaction, and my parents, could never talk about it, traumatized them. But apparently I was a full code, completely dead. So I'm hearing all these paradigms, the calories in, calories out, all the, low fat and all that. It's all about eat less, move more, all that stuff. Well, none of that was kind of working out. And they showed that Alzheimer's disease, which is really, if you look it up, they call it type 3 diabetes or insulin resistance of the brain. Alzheimer's disease starts showing changes in these functional MRIs in your late 40s. Western medicine likes to think that everything's a blue, sunshiny day. And then one day a lightning bolt comes down and goes, you got cancer, you got diabetes. And that's not the way it goes. You've got a fertile soil growing some things you don't want to grow.
Hi, everyone. I'm Joshua Lyon, a physical therapist and owner of Propel Physical Therapy. I'm host of the Provider Spotlight series. With us today is Dr. Brent Brotzman. He's been an orthopedic surgeon for the past 3 decades, so ton of experience. He's an author, and he's not only the owner of Brotzman Sports Medicine here in Austin, Texas. He also launched a business focusing on metabolic health called Opti Metabolics. In addition to his many professional accomplishments, he's a father of 5, an elite tennis player. So I know you're going to learn a ton from him. And I'm thrilled to have you on the show. Thanks for joining me.
Oh, I like it when you say elite. All my buddies I play tennis with are going to love that one.
The rumors out there that you're elite, so we can stick with it for now. And
and spiraling down slowly.
Okay. Well, I love it. Again, being active. I know you're big into that, and just again, people want to hear about you and learn about you. So just super informal. Want to hear about your background. What got you into healthcare? What got you specifically into orthopedics, and just some of that evolution for you?
Well, Josh, when you say I've been doing it 30 years, I'm thinking that can't be right, but it is 30 years plus another 14 of training. So yeah, I'm getting a little long in the tooth, but I love it. Yeah, started back when we were riding horses to the clinic. It's almost that long ago, but
making house calls, right? At that
yeah,
those days,
an old leather bag. Wasn't quite that old, but it seems like it. Now I'll tell you, it's interesting. My story of why I got into medicine is kind of a cool, unique one, I think. Back when I was a kid, born in 62, so in the 70s, I had a bunch of tonsillitis or, always had strep infections. And back in the 70s, they would give us a bunch of injections of penicillin. And so about the sixth or seventh one, I had an anaphylactic reaction, and my parents, could never talk about it, traumatized them. But apparently I was a full code, completely dead. And my primary care, my family doctor, Dr. Ham, there in Pasadena, Texas, basically always kept his patients there for a few minutes, make sure they didn't have a reaction. So he came running in and very calmly gave me the full code, brought me back to life. And my parents were like, wow, crazy. So once I kind of got older, knew the magnitude of the fact that, he had been very conscientious and had kept me around. And then he had been cool under pressure and, saved my life. I was like, sorry, I think about that story, get a little emotional. But anyway, I think about, so I like to do that for other people. Not to say that I want to be running full codes on my pages in the room, but so I thought, wow, if he did that for me, I'd like to do that for other folks. So it was easy for me. So at that point, school and everything's like, that's what I want to do. All my friends like, I don't know what I want to do. And that was easy. So yeah.
Okay. And how old were you, you said, when you had that full code?
I was 7, and I probably, and so when my parents kind of told me in high school, when I kind of figured out the gravity of what had happened, I thought, okay, that's what I want to do. So
that's awesome. Talk to me a little bit, if you don't mind, about kind of the evolution of becoming an orthopedic surgeon, what you're akin to treating ideally, and then even the shift now into the metabolic health, the business that you're running there. Talk a little bit about this evolution.
I thought I wanted to be a family doctor because I kind of love that dynamic. But when I went through school, all the family practitioners seemed like they were miserable, as did the patients, because, they were kind of, they were telling them, hey, you need to eat less, move more. You need to do caloric restriction, all the stuff that, we kind of know is wrong. You need a low fat diet and, low cholesterol. And so, all these folks were gaining weight, and the primary carers were saying, hey, you're not doing what we're telling you. And the patient was saying, I'm doing exactly what you told me. And so everybody was unhappy. So as my oldest of my 5 kids always tells me, we go to movies together. I only like the movies with the happy endings. And he's like, hey, Dad, every movie can't have a happy ending, but when you're in the doctor's office all day long seeing the human condition, you like happy endings. So at that point, I thought, okay, I'd like to be a family practice, but everybody's miserable. They're not really, nobody seems to be kind of getting what they need out of it. So that's when I decided I want to do some type of surgical training. And then, as an athlete, all orthopedic surgeons are strong as an ox and half as smart, and, just former athletes, so I can relate to all my athletes, so that was kind of, orthopedics was spot on for me right away. So
straws and oxen, half as smart. Is that what you said? Now, given the fact you've been doing this for decades, you've written books, you have been in clinical care for forever, and even the standpoint of being head of different organizations, clinical instructors. Clearly, you've kind of done a little bit of everything. Talk about your latest venture.
Oh, I want to tell you, you remind me of something funny on your physical therapy, because you and I were talking about therapy the other day. And of course, we know each other well, and we've known each other for a while. And that's the thing I love about you. I kind of have, sports medicine, orthopedics is it's got a lot of physical therapy in it. And it takes me back because, I love it. You have a great intellectual curiosity on some of the stuff we're discussing, like, why are we doing this ACL rehab this way? I learned it this way. This article says this. One of the funny things about therapy, I've always been really pro physical therapy, is, I was training at the Campbell Clinic. It was at the time, supposedly the, biggest, best program in the country. And they wrote the big ortho book. And I was actually doing some ghostwriting for some guys because most doctors don't like to write. My mom was an English teacher. So anyway, but at the time I was having, in the charity clinic, we'd have 50, 60 patients that we didn't operate on. And so you wouldn't know, what I love about my practice, I see all the family. I see, the first patient tears his ACL, then I see his wife, then I see his, so I know everybody in the family, and I know kind of their history. But in this charity setting, you'd see 60 to 80 people a day with your crew, and you didn't know what stage of, they were in their ortho care. So I started looking in these obscure journals like the Journal of Sports Physical Therapy, which no orthopedic surgeon was reading. And I'm getting all these protocols and I'm putting them up on the big charity clinic wall for myself. So I can say, okay, so this guy is 2 months out on a dislocated kneecap. I need to do this, and this. Well, then I noticed all my colleagues were stealing, taking down my
taking your protocols.
Yeah, I'm like, hey guys, leave my protocols up there. But then I thought, oh gosh, okay, so I'm not the only one that's kind of struggling. Mm-hmm. And so what happened is I'm doing some ghostwriting for helping out some of my attendings with some of the book chapters, and got to know the folks at Mosby, Harcourt, Elsevier, huge medical publisher. I think they're number 2 in the world. Yeah. And so and I kept writing, because it's so important to have I can do a beautiful ACL, but if you and I don't, and the patient don't do a great job of rehabbing it, you can do the most beautiful graft and, perfect surgery. But if they come with no muscle and no motion, whatever, so, therapy is really important. So I kept, in the ortho book, I kept writing in these therapy protocols, and they kept trashing them, putting them in the trash. I was like, guys, really important. And they said, Brotzman, we're an surgical book. But, tell you what, if you want to, we're going to give you a chance. We'll let you write your rehab book. So that's kind of how, the books came about. And, now I don't write them because there's so much great stuff on the internet, there's just so much. But back then there was not a great interface between ortho and PT. You just send them over to the therapist and say, hey, rehab this rotator cuff. And the therapist, and then sometimes the therapist would be being super aggressive. And I'd say, come on in, I want you to show you the surgery. And I'd show them like the tendon that's, 3 millimeters thick. And they're like,
yes, a little fragile.
Yeah. So the reason that, book was a bestseller in 13 languages really did well. But I think it's because it was not because of my writing style. My first one was horrible. I got better and better. But it was mainly because, there needed to be this common ground between therapy and ortho where we kind of like started talking the same language. And a lot of orthopods like, I won't send my patient to a therapist because they're going to rupture the rotator cuff. That was way back or they send them over there and say, I don't know anything about what they're going to do. And so we got this beautiful dialogue going back and forth, because the therapist is super smart and they know stuff, but they kind of need to hear from us. We need to hear from them. So we got some common dialogue. Yeah, I always enjoy our interaction on our patients because it just reminds me of, all the years with therapists. The problem is you guys always like to say, okay, hey, Brotzman, you wrote this book. Here's a really hard one. It's like, just give me the easy one.
Yeah. Well, the fact that you, again, literally wrote the book, I think we as PTs tend to like, cool, I see the protocol. What can I do different and unique? It's like, hey, it's been proven. It's pretty well established. But the fact that your life experience, everything from becoming a surgeon and going into healthcare from your experience as a child to growing up with your mother as an English teacher. So now you've got a little bit more familiarity with writing and comfort in that just kind of all those life experiences led to, some of the incredible things you've done. So I didn't realize the book was written in 13 languages. I knew it was big, but 'cause I had it in school, actually. I think I told you this, your rehab book. So
I like it when it's required reading.
It was required reading. I had to purchase that bad boy. It was good, though.
Whoever's around here give me a hard time. I'm like, yeah, I'll give you, back then, I'll give you a free copy. They're like, I already paid for it.
Yeah.
Awesome. But yeah, I mean, what was cool about it is my parents always encouraged me to kind of think outside the box, or, hey, if you're struggling, then, think about, okay, other people are struggling and what can you do to make it better for them or for you? So that was kind of how I started going down the metabolic health, venue was.
Yeah.
I'm very observant, Teresa, my wife, would say probably not that observant, but in the clinic, I'm an idiot a lot. In the clinic, I'm very observant. At the house, when the trash is piling up, not quite so observant, right?
Yeah. Well,
we all have.
It's a trained eye. It's a trained eye. So
great. But yeah, they're in clinic, when you're lucky enough to be blessed with seeing the same folks for 30 years, the families, and you have relationships with them, and you're saying, wow, okay. So I'm hearing all these paradigms, the calories in, calories out, all the, low fat and all that, but it doesn't seem, it's all about eat less, move more, all that stuff.
Mm-hmm.
Well, none of that was kind of working out. And then I was seeing all these kind of interesting trends. Like one of the things that we have a lot about is leptin. And I read some obscure article about leptin and it kind of applied to a lot of stuff I saw in knee surgery. Or I'll tell you a really interesting one was I kept seeing folks with gout. I'd see a lot of gout arthropathy on foot and ankle and knee surgery stuff that I would do. So these patients would have gout, which is, uric acid, but they would, every time I got an x-ray of them, almost every one of them had calcification of their arteries. And so I was like, what is the relationship? Why do these people with gout almost invariably have, calcific artery, deposition, which is indicative of atherosclerotic cardiovascular disease or having, cholesterol plaques. And as it turns out, that's one of the cool things in the book I'm writing now, and also with our company, is it turns out that, that there's some properties of fructose, dietary fructose, and that when you eat a bunch of it, it goes immediately to your liver. Your liver can't process it like it does glucose. So you basically go, instead of making ATP, the fructose kind of knocks out the liver and it goes ATP, ADP, AMP to uric acid. And uric acid turns out to be a huge oxidative stress to all your endothelial cells, the little cells in your arteries, and it disrupts the junctions. So you get disruption at the blood-brain barrier, you get disruption at your arteries, small and medium arteries. You have problems, same disruption, leaky gut syndrome is part of this fructose issue because the same endothelial cells line your gut, and so you get some leaking at the junctions. So it's crazy. Over the years, you're like, okay, so you start putting it together and reading obscure journals and figuring out, certain pathways. And now we've got some really interesting stuff in our metabolic health around that. So
I love that. So the fact that you've more or less cared for a patient across a lot of their lifetime, you've seen them for multiple injuries or family members, and you've kind of walked through their life. You know this then probably better than most, where people wait and wait and wait until something's truly an issue. As you reflect on that and with Opti Metabolics, what would you recommend or talk to folks about getting things addressed early before you now have a lifestyle change that you have to make?
Yeah, I mean, I think that goes across orthopedic surgery, that goes across metabolic health, Opti Metabolics. My mom hated to go to the doctor because she didn't want to, ever get bad news. And
Yep.
A lot of our patients say, I don't want to do therapy unless, it's post-op. But when I was a kid, we never heard the word core. I guess we had pretty good core, but, we just weren't as attuned to it. And I guess we probably had some of it, but I would say, if you're having like back pain and your doc says, hey, go to the therapist and get a strong core and then, do some of these extension exercises. I think that's so much better than, we have to send it to the neurosurgeon to have your, disc addressed or a fusion in your backs. So that's part of it. And then it's huge with Opti Metabolics, with your metabolic health, because a lot of stuff we're seeing for our patients are 20 years ahead of like we have some interesting studies where they looked at 19,000 functional MRIs, and they showed that Alzheimer's disease, which is really, if you look it up, they call it type 3 diabetes or insulin resistance of the brain. Basically, Alzheimer's disease starts showing changes in these functional MRIs in your late 40s. And what's happening is you're getting so many blood sugar spikes from the standard American diet, and your pancreas is producing all this insulin. You got excess insulin. Over time, the brain cells in your brain start down-regulating the insulin receptors, and pretty soon you can't get any sugar into those cells. And so they're showing that actually starts being a problem for in your 40s. And by the time you're symptomatic in your 70s, big pharma wants to tell you, well, we're just going to pull out the misfolded proteins out of your brain. Well, the brain cell's dead. So It's kind of one of these things where, if you're looking through the lens of, that's the problem with a little bit with Western medicine and the way they teach us in med school. It's like, okay, the patient comes in with disease X or problem X, and now you're going to treat the disease. But you don't even get in ortho, you don't even get reimbursed for, as I start transitioning to a lot of metabolic stuff, preventative. One of my astute medical assistants who's been with me for 15 years says, Brotzman, we're not getting paid for all this preventative stuff. But it's important. Yeah. So I think it's critical, you don't want your brain cell to be dead at 70, you definitely would like to come in and get a workup or have the knowledge of, wow, okay, so Alzheimer's disease is neurodegenerative, but it starts 80% of folks that have it in the Mayo Clinic registry either had prediabetes or type 2 diabetes. Okay. It's multifactorial, but X amount of it, involves insulin resistance syndrome. There's a bunch of books. Ben Bigman's got a good one. So if you know that and you can say, hey, okay, so insulin resistance, how do I get out of that? Okay, quit eating blood sugar spiking stuff, get my insulin down to 6. Knowing that in your 40s is critical because, Western medicine likes to think that everything's a blue, sunshiny day, and then one day a lightning bolt comes down and goes, you got cancer, you got diabetes, you got, and that's not the way it goes. It's, you've got a fertile soil growing some things you don't want to grow, and it's not a blue sky, but, you're kind of in a Western medicine, non-preventative scenario. So, physical therapy is the same way. If you've got a good core strength, if your therapist has told you this is how you squat down, and gives you good ergonomics at your desk or ergonomics for how you're lifting things, or what you and I love is sport-specific ergonomics. So it's like, hey, you're hitting this big semi-Western forehand, but you're leading with your elbow. It's tearing your medial collateral ligaments. So we got to get your pro to change your form. You're doing too much in a day. We got to change up your training regimen. I think it's critical in, as an athlete, as a person who's sitting at a desk all day long, as somebody who's trying to eat right. And, a lot of the paradigms that we're following are kind of false, monetarily motivated paradigms. So it's kind of good for somebody to tell you, hey, here's the real thing to pursue. Right.
Okay, so you've got someone who at my age in their 40s, and now, they may not see the results of something until their 60s, 70s, but there's underlying things happening now. What would you tell someone who otherwise feels fine, but isn't realizing this kind of slow cumulative effect, slow decline, whatever you want to call it? How would someone like me best connect with you? And what would I need to do next steps then to get my baseline established and see where I stand so I can prevent stuff before I'm 60, 70, 80?
Yeah, that's a great question. Well, right now, we've done a bunch of betas through multiple waves and had great success with them. we're trying to do. We've got kind of a platinum program where we, OptiMetabolics.com, where we get 100 biomarkers, lab work, and we do 100 biometrics, and we put you in this, crazy thing where we look up all your oxidative stresses, your inflammatory stresses, all the things that can kill you. So we're giving you risk ratios for the top 10 causes of mortality and about 70% of chronic disease, and we're giving you your methylation status, your biologic age, your cancer risk of cancer, all that. That's really cool. But we're also working on, we've got some other interesting things where we're also, I think, going to be able to do a snapshot where folks can send in their lab to us, and we can say, okay, look, your doctor thinks uric acid is related to gout, and your parameters are 7, but we've got several studies here that show that uric acid is related to excess fructose. So you're eating too much sugar. 50% of sugar is glucose. 50% is fructose. You got this excess fructose, and that's going to uric acid, which has this horrible oxidative stress to your arteries. So we'll give it to you in another metric. So we're working on kind of looking at your current labs and giving you a snapshot, or here's the things you need to look at.
Awesome.
And GGT, I'll give you one other interesting one. So GGT is, everybody looks at it as just, it's a lab metric to assess your liver. And it's to see if your liver's healthy. But what it's really telling you is we've all got this huge antioxidant system that's glutathione based. And so if your GGT level is off, that means your body's undergoing a bunch of oxidative stress, and it's having to use a lot of the glutathione-based antioxidant. So we're giving it to you from a different lens. It's just not your liver. It's, so, and you I'm sure you probably saw, because you have young kids, that they came out recently and said, hey, you really don't want to give kids Tylenol.
Yeah.
Because Tylenol is tough, and it even a lot of times they're given around the time of vaccines, which is a problem because Tylenol puts a huge oxidative stress on your whole system, and so it requires a lot of this glutathione based antioxidant system. So they're basically just saying don't use Tylenol now.
Okay.
So anyways, it's the body is an amazing thing with lots of stuff going on. And when you look back at the miracle populations, they weren't really miracle populations. They were just, we are not a miracle population. Their antioxidant system wasn't getting overwhelmed, and they didn't have people telling them to eat 6 times a day, small meals, and with elevated insulin. And so, it's interesting, but I would say, come to OptiMetabolics.com, and we'll give you lots of interesting educational stuff, and then hopefully we can work you up and just basically see, if you have any big underlying problems that may manifest later. It's always better to know now than later.
Yeah. Well, like I said, the miracle of the human body being able to withstand decades of stress before something finally, gives out is incredible. But say you're like me and maybe diet's not on the forefront of your mind, or maybe you need a little accountability or, hand holding, however you want to word that. Great. I get my baseline established. I know where I stand on all these lab values. What's next in the pipeline then to kind of get me to a better state?
Yeah, what we're doing is we check our folks every quarter. We do repeat lab work, and we also have coaching with our coaches, and we have this huge. It's great. So like everybody always says, "Hey, Brotzman, are you selling supplements?" And I'm like, is your company is the supplement? So he's like, no, the key is we don't want to sell you antioxidants. We want to tell you what the oxidative stress is. It's like, if you're putting maple syrup into your gas tank, and then somebody comes along and says, hey, here's some SDP fuel cleaner. That's kind of like an antioxidant. Well, maybe that's going to help, but the key is we don't want the maple syrup in the gas tank, but oxidative stress. So our big premise, so what we do is we look it all over and we put it out, we give you your risk stratification for cancer, the top 10 causes of death. And then we how to mitigate it. And then you can click on the thing and say GGT. Brotzman's talking about GGT is some liver thing, and it pulls up and it gives you all the information you want. It'll send you to educational sites. It tells you what your lab value is compared to, why it's important, all that. So it's very educational, and then we're following you along. And so a lot of our, and we give you a lot of educational stuff because one of my clients the other day said, "Oh man, I had to give up Diet Coke. You're killing me." But she wouldn't give it up until I gave her there's that huge Harvard study that shows 2 sugar sweetened beverages or artificially sweetened beverages, 2 a day, increases your mortality risk by 21%, your diabetes or type 2 diabetes by 67%, increases your cancer rates. And this is like, it was done with 14 million years of, it's a 30-year long study with 100,000 plus folks, and they matched all these other things. That are just a beautiful study. So when I show people the study, like, damn, I got to give up the Diet Coke.
Pretty convincing at that point.
And then magically, it's fascinating. Then all of a sudden your glucose levels, fasting glucose are doing better. Your insulin's doing better. Your oxidative stress are better. It's like, it's magical how that happened, So it's really rewarding, and it's been great to see our folks muscle up and get less oxidative stress and have all their lab work starting to look good and losing their visceral fat. It's been good.
That's awesome. Well, great. Well, wrapping up here, any final thoughts or comments you'd like to convey to the audience about either yourself, your sports medicine practice, Opti Metabolics, any parting words for anyone tuning in?
I like it. I'm glad you and I get to talk because I enjoy our conversations. I wouldn't say you're at the beginning of your career because you're just not ancient like me, but I love sharing the surgeon in me and the kind of seeing the family. I feel like it's kind of like almost a little bit of a family practice because, like I said, I like to see grandma and the kids and mom and dad. But I love it. I feel like you're one of the guys that kind of sees it in the same light I do, which is, okay, we have problem X and we've got to apply. It's not just like cookie cutter. It's like, okay, so you're a soccer player and you're having, weakness in your VMO. We're worried. We're afraid that if you go to the position of no return with your knee, that you're going to tear your ACL. So let's do these preventative measures, to strengthen your thigh. Let's do it in a way that it's closed chain and it's not going to hurt your kneecap. So, I think you and I have a very similar philosophical approach. Nobody, insurance doesn't reward you for it. You don't get any money.
They don't.
For much of anything nowadays in therapy. But, you go home feeling good, knowing, okay, well, I feel like, this volleyball player, when she jumps, she's not going to go into valgus or the position of no return, or this soccer player should be, less likely to have the injury. And so I always enjoy our conversations together on that. You're one of the guys that I think truly believes in the prevention, an ounce of prevention type deal, worth a pound of cure. And I think that's, as a surgeon, you really, we got plenty of surgeries. You don't want to have surgery unless you have to. And so we try to prevent it for you. So
awesome. Well, thank you for that. And excited for your next book coming out regarding the metabolic health stuff and all things optimetabolics.com. Excited to see that grow. And thank you for your time today. It was awesome. Pleasure having you on the show. And have a great day.
Yeah, I could just barely work these controls. As the old guy, I was like, where's my horse race?
All right. Thanks. Have a good one.